I'm Julie Hanks, LCSW, with a question from an 18-year-old female. And she writes, I get serious anxiety before I have a therapy session or when I need to call my therapist. I do therapy over the phone. My stomach gets really hard and tight before I call my therapist. I get a ton of other physical symptoms, including muscle tension, diarrhea, tightness in my chest, shallow breathing, nausea, etc. I've talked it over with him, as I think it might be a transference thing, but it's getting to the point of not being okay. I've had nervousness with other men, particularly doctors and and other people in authoritative positions, but I've never had it this bad. The kind of therapy I do is based on primal theory as well as other things, but it also makes it very hard for me to feel my feelings when I get so nervous around him. I don't really want to switch therapists right now, but I would appreciate any suggestions. Yeah, it sounds really, really painful and overwhelming. I guess my question is, are you able to work through the anxiety and make progress in therapy? If not, then it sounds like something needs to change. You might want to talk with your therapist about looking into medication for your anxiety, or considering doing some in-person sessions where you can have more of the therapist's presence to help calm you. But yeah, that sounds really overwhelming, and it's something that needs to be addressed. If it can't be overcome with this male therapist, then you may want to talk to him about transferring to work with a female therapist to get a handle on your anxiety, and then working with a male therapist after that to work through some of the authority and male issues that you have. So those are my suggestions, but something does need to change. That's therapy, although it's supposed to be uncomfortable because you're dealing with hard things, it doesn't need to be incredibly painful, which it sounds like you're having a panic attack before each therapy phone session. So you need to get a handle on that. Again, medication may be an option, so talk with a medical provider about that, and consider working with a female therapist if this doesn't get better. Hope this helps. I'm Julie Hanks, LCSW. You can find out more about me and my practice at juliehanks.com.